Hey everyone. So we have a very interesting topic today, as usual, I suppose. We're going to be talking about psychedelics and psychotherapy. Now, most specifically, I'm going to be focusing on the psychotherapy component. There's a lot of content already out there about psychedelics, what trips can look like, and so on. I want to focus on this from the perspective of a mental health provider myself and where these drugs fit in the psychotherapeutic process. For people who come in, maybe they'll have their own experiences. They're welcome to share if they want to. But I'm going to start with an overview of psychedelics here before actually going into the relevancy to psychotherapy, how we might fit this into the management of various mental disorders and different types of psychological suffering, and what the relevance will be for the psychology of awakening and helping us find freedom from psychological suffering. So as usual, let me just type my prompt here and then we'll get started. Oops, I made a typo there, but that's fine. Okay, so first things first, what is a psychedelic? This term gets thrown around so often that we kind of lose clarity on what a psychedelic is. You'll see people talk about anything that has psychological or psychotic, if we want to put it that way, hallucinations, delusions, imagery. It's not really fair to even call it a hallucination. It's more so like an alteration in sensory functioning or just an alteration in psychological functions in general. When we say hallucination, that comes with some loaded terminology as well as delusion. If you talk to anyone who's had these kinds of experiences, whether it's through psychedelics or other forms of altered states of consciousness, you're going to see that they will tell you this is one of the most real experiences in their life. It does not feel hallucinatory in the same kind of way, right? When we look at other types of drugs, perhaps methamphetamines or marijuana in some cases, those can cause certain types of perceptual distortions. But in some cases, and this is very relevant to forensic psychology, in some cases, they fully recognize that these drugs are causing those kinds of effects. They might even tell me things like, oh, yeah, I'm aware that this drug was making me believe the bush was alive, even though it actually wasn't, in terms of arms, legs, a mouth, a face. That's different. When we're talking about psychedelics here, it's kind of difficult to put into words. I might pull up a video or something later to give you an idea. But again, people report these as very real experiences. So before I get too far in the weeds here, psychedelics, what we talk about here, many different definitions, but one that's increasingly agreed upon is that these are drugs that act primarily on the 5-HT2A receptors, and they function as agonists. There's other neuropharmacological properties at play as well, but that's typically what we're referring to when we talk about psychedelics. LSD, DMT, psilocybin, these are some of the most well-known examples of traditional psychedelics, so to speak. Now, psychedelic itself, this word means essentially like soul viewing or soul opening, right? It's kind of like a gateway that opens up the dimensions of mind that we typically are not aware of in our day-to-day waking state. For those who have never taken psychedelics before, it's kind of hard to understand these things, but everyone has had dreams, right? If you've had dreams before, it's kind of a similar thing in the sense that you're experiencing an altered state of consciousness. Now, the contents of what you have, that will be vastly different from what reports of psychedelic states are like. But in a general sense, you get the idea that there are other forms of consciousness beyond just your normal waking state. In neuroscience, we typically call these the states of consciousness and the contents of consciousness. We'll just stick to psychedelics for this one. We won't go into other forms here. So now that we have a basic understanding for psychedelics, these are pharmacological compounds, drugs, whatever you want to call them, that operate primarily on the 5-HT2A receptors and cause a variety of sensory and psychological changes, which mechanistically seem to be related to the ability for the brain to alter its neuroplasticity. This is another jargon term. When we say neuroplasticity, we're talking about changeability of the brain, the ability for the brain to change how it is functionally connected and how it is structurally connected, both together. When we talk about functions, these are like changes in how we psychologically understand things. Structure, we might see differences in dendrites, synapses. If you think of neurons as trees, right, you have your main trunk in the middle. And again, there's many different types of neurons here. We'll just talk about the most stereotypical neuron that someone can imagine. You'll have a trunk in the middle, right? And then you will have a soma or a nucleus for this neuron at the top, and then you'll have arms and branches that go out. These are your dendrites. Your synapses are at the very end, and then on the bottom side you might have some dendrites as well. So if you take a tree out of the ground, it looks very similar to the stereotypical neuron. When we're talking about neuroplasticity, we're talking about how those leaves and branches at the ends of neurons can change. So when these change, we tend to see differences in psychological functions if those changes occur in a certain way. It doesn't have to be from psychedelics in terms of changes, right? We see changes in the brain throughout the day, throughout psychotherapy, throughout different states of consciousness. The brain is always in a state of change. This is relatively normal. The difference psychedelics offer is that the type of neuroplasticity that we see, I'm going to try to not get too much into the literature and jargon here. I want to keep this focused more on the psychotherapy component, but we have to do some level of overview. The type of neuroplasticity that we see for psychedelics, it offers something that you might see called a window of flexibility. So this is when different types of psychological beliefs or rigid structures, right? We're thinking about schemas here. We're thinking about how people view the world. We're thinking about how people identify with their addiction, their depression, their traumas, all sorts of things there. The psychedelics seem to create this window, this temporary window, where a lot of these beliefs and rigid structures are basically thrown up in the air, right? So normally we're kind of settled down like sand at the bottom of the water. And psychedelics is like basically taking a giant explosion from the bottom, and then all the sand comes up and everything is up in the water. But eventually it settles back, and it will settle back in a different way. So, more or less, this is what the psychedelics do. There's a lot of emerging research to come out in terms of mechanisms. Really, we are only in the infancy of what we understand about psychedelics. So many unknowns here still, but this is one of the primary mechanisms from which we understand psychedelics at this point. And the reason for that is because we've gone decades after LSD was initially discovered, and Timothy Leary, another psychologist who really promoted the use of certain psychedelics, especially LSD. I won't go into him, but essentially what happened was the ban on LSD and psychedelics came from a number of problems related to usage and implications, lack of understanding. It's only been recently, within the past decade or two, that we've had a reemergence and started to look more into what exactly these drugs do from a more serious and scientific standpoint, as opposed to just taking them as a recreational and kind of fun thing to do. Okay, let me see what else I want to say about psychedelics here, and then we can move on. Yeah, so a little bit of neurobiological jargon here as well. In terms of what exactly is happening, we know that brain-derived neurotropic factor and TRKB receptors are implicated. You don't need to know any of this jargon here. Just know that there are some biological mechanisms that seem to play more of a key role in how these neurons and how our brain restructures itself. So this is basically saying we have certain types of sand, right? What is it that allows the sand to go up, the explosion? What allows the sand to go down in certain other ways? This is what we're talking about with BDNF and the TRKB receptors. So I won't go into that any further. Essentially, we have some underlying mechanisms, basic ideas on how these things work. Okay, let's see what else we got here. Yeah, so I think that's good enough. We'll get into the psychotherapy portion here, which, in my opinion, is the most important part of what these drugs do and what they are capable of. We're not just going to take these drugs and find all the answers and all the freedom that we are looking for in terms of psychological suffering. It actually happens to be the case that no matter what you do, it's more so the insights and understanding you get from these experiences that lead to the long-term outcomes. This is something that we see well implicated with long-term long-term stability from the use of psychedelics, right? What I mean by this is somebody takes psychedelics, they have a breakthrough experience, really changes them. Does that change sustain over time? Or does that change get lost and then the person returns back to normal? The psychological components and how people understand their experiences, that plays a very crucial role. And this really is no different from any other type of therapeutic experience, right? If you're sitting with a psychologist or some other therapist and you're going through a trauma or you're going through a difficult set of experiences, you're doing the same kind of thing, right? We're talking about a difficult, rigid structure within someone's psychological functioning. And then we're basically bringing that up for examination, figuring out how we want to re-identify and re-understand things for a more effective way to work through that experience. And then we're settling those back in terms of day-to-day life. Really, it's not too different here. The only, well, it's a pretty big difference, but the big difference here is that psychedelics are very different from the normal day-to-day experience. You know what? Very quickly, let me just pull up a few pictures. I want to show you, for those who aren't familiar, what kinds of things people report in their own experiences. So let me go ahead and pull this up here. Okay, so hopefully that is showing. Yeah, it looks like it is. So just a few examples here. Can I make that any bigger? All right, maybe not. I'll just go ahead and work with this. That's fine. So a few examples here, right? When we look at the top right, you see this pattern often. If you ever think of fractals and infinite patterns that go on, this tends to be something that people often see. Now, why exactly this is the case, still unknown. There's a lot of theories out there, but no one really knows for sure. It's just a very interesting thing. Probably relates to alterations in how our visual system is operating. Okay. So a few other things. You'll notice a theme and pattern about eyes, faces, and to a certain extent, what it is you were thinking about at any given moment has a deep impact on what it is you are experiencing. So it's a very important thing, and we'll talk about this with the psychotherapy side. It's a very important thing to have a good background preparation. And by this, we might talk about set and setting, which we'll get to a little bit later on. But your intentions, what you psychologically believe, what you plan on happening, or what you anticipate is going to happen, all those different things have a deep impact on the type of experience you get. And again, when we're talking about psychedelics, we are talking about a very extreme example with drugs, but in our day-to-day life, mechanistically, it's really the same thing. If we do meditation as well, we're going to see similar outcomes as well. All right, so getting into the psychotherapy portion, I want to start off by saying that we don't have any single clear psychotherapy style to use for psychedelic assisted psychotherapy. This is the common type of word that we see, PAP, for what type of therapy we engage in. This is still up in the air, right? Clinical judgment, looking at the literature, seeing what works, what doesn't work. It's still really up in the air. It's just too early to have anything meaningful here. But there are different techniques that seem to work in different ways. Psychedelics have been around for a long time, and it's only been recently in Western society that we've started to use these more and more. But if you go to other cultures and other countries, you will see that they've used these drugs for hundreds, if not thousands, of years. Now, they have their own style of psychotherapy. I mean, that's really what we can call it, regardless of what someone is doing or not doing. There's some form of psychotherapy involved with every single approach, whether it's just sitting there and just using the drug yourself and then reflecting for a few minutes, whether you decide to sit there with someone else and that other person helps and functions more or less as a supervisor or a collaborator. All those are different styles of doing psychotherapy, if we want to look at it from that lens. So, with psychedelic assisted psychotherapy, we have three different stages, primarily speaking. Again, a lot of this a lot of this is up in the air. So, preparation, support during the session, and integration. All three of these are related to the type of experience that you'll get in terms of the psychotherapy portion. So, in terms of preparation, this is where just think of a regular psychotherapy session. This is where, and let me check something here. Okay. Yeah, this is where we are going to really establish a good relationship with the person or the provider, so to speak. Typically, what happens, and it's still debatable on how many sessions are needed. Some arguments say you only need one really good breakthrough session, very strong dose of psychedelics. Others say we should do multiple smaller sessions. Some talk about microdosing, but literature is still out on that one as well. We'll stick to just one or a few sessions here. Typically, what happens is you meet the team or an individual, whoever it is that's involved, and then they will essentially form an alliance with you. This is exactly what we're doing in regular psychotherapy. When you're going through the intake, clinical interview, talking back and forth, you are establishing a relationship. And just like psychotherapy, that therapeutic alliance, that trust in this person, that has a very deep impact on what the outcome of the psychedelic assisted psychotherapy is going to look like. Along with that therapeutic alliance, there are going to be intentions that are set about what happens. These intentions are crucial, again, because we're setting the basis of anticipation or understanding on what's going to happen. For people who've never done this before, the first time, even for people who have done this before, every trip is very, very strong, we'll put it that way, in terms of what people report and experience. Dr. Forget his first name, Rick Strassman, I believe. He's written a lot on what people's experiences have looked like. Stanislav Grove, hopefully I'm saying his name right. He's another psychiatrist who has had a lot to report. Robin Carhart Harris, he's perhaps one of the top researchers. He might be the top researcher for psychedelics currently. And there's lots of data out there from him as well. So lots of different things out there in terms of what the intentions and what people might expect and how that pans into the actual experience. Lots of different bits of information there. Okay, and then finally, educating the patient about the experience. Again, I don't really see this as being any different or significantly different from general psychotherapy. We're going to talk about what the therapy involves, what the outcomes are. We're going to set certain goals. We're going to collaboratively come up with the treatment approach, what we want to do, what they're comfortable with, what they expect, set things in a realistic manner, and essentially go from there. So, this is all within that preparation phase. It's kind of like the intake, setting the expectations, and so on. I don't think there's much else to say about the preparation piece, so we can move on from that. Now, once that's all set, again, you want to check back and make sure the person is interested in doing these things. And I should clarify for myself that I have never done psychedelic assisted psychotherapy myself. I'm just going off what I understand from the literature, colleagues, other people who've had these experiences. I am not an expert in this content by any stretch of the imagination, just someone who wanted to share some of these things. And the primary reason I'm doing this video is because I've seen some people talk about how psychedelics will replace the need for psychotherapists. And to give you the short answer here, because I seem to have not done that in 20 minutes, the answer is no. No, psychedelics are not going to replace psychotherapists. And the reasons why, we will get into this shortly, but essentially the drug or the drugs, whatever it is you take, those open the door to experience and the dimensions of the mind that you won't see from regular experiences. But it is the psychotherapist and the psychotherapy experience that determines what the experience is understood as. So the drug opens the door, the therapist helps the patient walk through it and understand what the experience is. Okay, so let's keep going here. Now, let's say we get to the actual session itself. Now, the type of psychedelic that is used, the dosage, the frequency, all these different things are going to be settled during the preparation session. During the actual session, this is when the individual will take the drug or the drugs. Now, usually what they do is they will have a certain type of bed or a couch or something comfortable to lay back on. And oftentimes, once they actually give the drug, they are going to stay with the patient. And this is really important because the patient is going into an extremely vulnerable place, not only psychologically, but physically as well. Trying to walk or trying to function, what was his name? The creator of LSD, is it Albert Hoffman? Let me look that up real quick. Yeah, Albert Hoffman, when he found out that he had taken LSD for the first time and didn't really know it, he had a hell of a trip on that bicycle. And there are still people who do this annually to to recreate and honor what Dr. Hoffman did. But essentially, yeah, once your perceptions are distorted, it's very difficult to navigate your environment. So again, that element of trust is extremely crucial. So once you are actually going through this experience, you are to a good extent dependent on that other person in terms of trust to help you out and to give you a good guide in terms of what to experience and what to expect and to walk you through any difficult experiences. So as you start to go through this experience, oftentimes before as well, you'll see that guides will play music. It might be a rhythm or a pattern or just tapping on a cymbal or a drum in a repetitive fashion. It's something that helps shape the experience for whatever reason. Having that type of background noise, again, the psychedelic experience is very heavily sensory based, right? It's a very strong manipulation of senses. That's how it feels to the person. So this is not only visual, it's also auditory, all five senses are involved here, but auditory and visual, these are the two primary ones that you try to control. So when you play the music and you set a certain rhythm and that familiarity is there, it can help ground the person to a certain extent, because when they're going through this experience, it's very difficult for the person to find any type of grounding, and that can be distressing for people. So having that is really important. And again, the therapist is also going to maintain a non directive and non judgmental approach. Very similar to psychotherapy as well. I suppose it depends on the type of psychotherapy you are doing, because if you go through certain psychotherapies, the therapist can be very directive and sometimes judgmental, unfortunately. But ideally, in this case, psychedelic assisted psychotherapy, they're going to be non directive and non judgmental. Now, why is that? Because if you are trying to be directive, you are going to shape the experience and influence it in certain ways, which can often be undesirable. If you're being judgmental and you try to minimize or impact the experience, again, you can induce negative bias or negative changes in one's own experience. Those can lead to problems as well. So again, you want to be non-directive and non-judgmental. Ideally, this is what we do in all types of psychotherapy because it gives a good environment and basis for the patient to come up with their own understanding and own mechanisms of change. Now, at the same time, you don't want to be spineless, right? Whenever something comes up, you need to be there to support the patient. This is where that clinical skill comes in. That clinical skill helps you know when it's time to step in, when it's time to help with an interpretation, or when it's time to, cat's going in the background, or when it's time to just move on from a certain type of experience. So, again, psychedelic experiences can be very intense, very challenging. Having that therapist there, having that background noise, having that familiarity, that can really ground a person. So, we want to make sure there's a lot of support during the session. And perhaps most important is the actual therapeutic component itself, right? Perfectly timed or well timed interjections, well timed interpretations, well timed non directive help. Those can really help reconsolidate all the different granules of sand of experience that have been thrown up in the air. The type of change that a patient is going to see oftentimes is insight focused and maybe nonverbal more than anything else. Again, insights involve that sudden understanding. It's something that I really push for with it's something that I really push for with different types of meditative practices because it is those insights that help give you a complete and holistic understanding of the picture. In this way, when somebody develops an insight, especially if it's more of a correct insight, this is where, again, the support during and after the session comes into play. When you have that type of insight and it sticks with you over time, that is perhaps one of the best indicators for lasting change. Now, this doesn't have to be the case with just psychedelics. It is also true for meditative practices and other types of psychotherapy practices as well. When you develop that insight and you get a good, coherent understanding of what's going on, then it can really help. Now, when we are also going through the session, the type of impact that the therapist is going to have on the individual, that is also going to vary based on the duration of the drug that's used, right? Certain drugs might work for hours, certain drugs might work for minutes. We want to be sensitive to that as well. Okay, and to go back a little bit here, I forgot to talk about set and setting. Set refers to your mind state. Setting refers to your physical environment that is around, right? So we want to have an environment with familiarity. We want someone who's ready psychologically. We want people who really are familiar and comfortable with the experience. Because if they have negative experiences or they're fearful, those can bleed into the type of experience that they have. All right. And then finally, the integration phase, so to speak, whatever you want to call it. This is after the experience, immediately after the experience, again, sometimes during the experience for the support during the session phase. We want to really help the patient understand their insights and what it is they experienced. This is so important because once these experiences happen, we've basically taken someone's experiences in mind and just thrown it up in the air. Now everything's resettled in a certain way. It hasn't really settled yet, but it's starting to settle. And how it settles is dependent on how they understand what happened. So this is perhaps the most important part of the session itself, other than actually going through the experience. We really want to help them formulate new perspectives and insights, release from stress, difficult things, and ideally promote ways of thinking and understanding that reduce psychological suffering. If this is done correctly, we see positive, long-lasting changes for individuals even after one of these types of sessions. At least that's what the literature currently supports. Okay, so that's an overview of what you might expect for a psychedelic-assisted psychotherapy. Again, this isn't necessarily the direct focus of what we're doing or what we're talking about today, but I wanted to go over that because it really talks about and gives an overview of how important the therapist is. Without all these different factors, someone might just take the drug, have an experience, and then they just sort of move on with life. And oftentimes, not oftentimes, but in some cases, these can be very negative experiences. If we have a good therapist and a good set and a good setting, we can at least minimize those negative experiences. Okay, let's see what else we want to talk about before actually getting into the psychotherapy component and the importance of different psychological models there. All right. I'll get to you later, okay? Okay. All right. Oh, yeah. And then one last thing here is from the Lancet. I was looking at a few articles before talking about this stuff, and I saw an article from the Lancet in 2023, and they talked about some of the promises and the concerns regarding psychedelic-assisted psychotherapies. I lost the article name. Maybe I'll find it afterwards if there's an interest, but it was from 2023. If you probably just Googled the Lancet Psychedelic-Assisted Psychotherapies 2023, you'll find this article as well. But they talk about some of the promising and not so promising parts of psychedelic assisted psychotherapies. So, on the promising side, is that long lasting positive effect on treatment, right? This is difficult to obtain even for depressive medications or current types of medications, SSRIs, SNRIs, stimulants, whatever types of medications are involved there. Getting that long-term positive effect is often difficult. And this is a problem, especially for medications, because what we find is that medications taken over longer periods of time, your risk for side effects and adverse effects, oftentimes it increases. We want to be really careful about that, right? When you get on medications, especially heavy hitters, benzos are typically not prescribed as much, but they still are in some cases. Those kinds of drugs can really have an impact over time. So this is one thing that psychedelics are great with, right? If you only have to take this once or twice or whatever it is, and then you see improvement, that can certainly help out. Now, at the same time, there are other drugs, and these are not necessarily psychedelics, but they do have psychoactive effects. These drugs can cause an increased risk for developing a psychotic disorder. We want to be really careful about these ones. Cannabis is perhaps the biggest offender that's coming up in research. Your risk of developing a first time or permanent psychotic disorder, it goes up astronomically whenever you take certain types of drugs. And these are often, if not always, drugs that are not psychedelics. Right? So cannabis is not a psychedelic drug. Ketamine is not a psychedelic drug, but they certainly seem like it, and the mainstream will pin these together. So we want to be careful about that. Actual psychedelics, DMT, LSD, psilocybin, things like that, your risk of developing a psychotic disorder is much lower. I don't know the exact rates. I'll have to go check the literature on that. But that risk is astronomically lower, if not completely eliminated. I need to double check that, so don't hold me to it. look that up yourself. But compared to cannabis, I can assure you the risk is much, 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 much lower. Okay, so from the Lancet, yeah, that's one promising thing, right? If we can give an experience and you just go through it once and then you return back to your normal day-to-day life, and we know these drugs have a much smaller risk profile compared to current psychiatric medicines, that's awesome. This is really, really good data, really, really good treatment. This is a really, really important and good treatment and data set to have. Okay, so one of the limitations as well, you'll often see in psychedelic studies is that the sample sizes are small. And there's a number of reasons for this, right? One, we're just coming out of decades of not using psychedelics in any kind of way. So people are very hesitant. They have certain ways of viewing these drugs. There's stereotypes that go with them. If you say psychedelic, often that comes with a negative connotation. People in research or academia, a lot of clinicians too, they'll just give you kind of a look like, is this guy off the deep end? Those things all limit the types of sample sizes that we get. So these can be issues as well. But regardless, the fact is sample sizes are generally small. So how do we actually generalize what we find into the overall population? What kinds of candidates are ideal for this treatment? So what psychological factors, what physical factors, what things do we want to consider in recommending or not recommending these types of therapies? That is another important thing. And then finally, there are what we call bad trips for psychedelic experiences. There's really been an upsurge and I would say overplay of positive trips, which, yes, that generally is the case when you set things up right, but you can still have a negative trip. And I just want you to think about this for a second, how important it is. When you're going through that psychedelic experience, especially if it's for a few hours, you can't escape what it is that's going on, right? If you're in a bad physical environment, you can just leave. Psychologically, you can't do that. It's inside of your, well, I'm not going to go there, but it's your psychological functioning. So inside of your head, outside of your head, whatever it is your functioning. You cannot escape from it. So if you're going through a bad trip, you are going to go through the bad trip. And that can be very traumatic and difficult for certain people. I'm going off memory here. I think it was for, let me look it up here. I think it was for Rick Strassman. He started to document negative experiences as well. You can look those up for yourself. I think one of his books was called The Spirit Molecule. And there's some negative experiences written in there. It can be very, very traumatic. Again, psychedelics, it doesn't feel like you're in a movie, right? It feels like you are the movie. If you feel like you're in a movie, there's a degree of separation of at all times, right? Oh, this is a negative experience. This is just going on in the periphery or whatever. But with psychedelics, it is your experience. So if there's a bad trip, it's not just really a bad trip. It's in that moment, it is a bad experience in that very life that you can't escape from. Like you are it. So that's something you really want to be careful, and at least in terms of what I've read and gone through with the literature, I want to see more discussion on bad trips, how to prevent them, and so on, because that alone can help develop traumatic experiences and perhaps even a trauma and stressor related disorder in some cases. So we want to be really careful about that. Okay, I think I'm spending too much time not going into the actual course of this, so I'll jump there in just a few minutes here, I promise. Okay, let's see what else there is to discuss from this article. Yeah, so a lot of logistical challenges on how are we actually going to put these into the widespread population. Let's just leave that alone. Okay, so to the actual fundamental question here, are psychedelics going to replace the need for psychotherapists? The answer is no. Because again, these psychedelics are kind of like, there's a good analogy for telescopes, right? Psychedelics are like telescopes. They are good at helping you see the full range, so to speak, of your own mind. But in terms of what those things actually mean, what they actually hold in terms of value in your day-to-day life and day-to-day functioning, that's a totally different story. That's where you need the psychotherapist, right? If you're really experienced and you really understand these things, you could perhaps do those things on your own, but it's always helpful to have someone else there. It's kind of like someone just giving you a telescope and telling you to look outside at the night sky. You can do that all day, but your actual understanding of what's there, that's not going to develop just from the telescope itself. Now you'll get certain new things, you'll get certain new understandings, but really the key stuff, the most important things, that comes from the hard work, that comes from the insights, the understanding, the perceptual basis, the interpretation. You need psychotherapists for those things. You also need well-trained psychotherapists. That's another limitation. We don't really have good training models on how to do these things. And I'm sure that will change as things become more widespread. But when you have ill-trained people, you're going to get ill-trained results as well. So again, really important to understand that it is the insight, interpretation, and understanding of the experience that matters most. Just because something feels a certain way for a psychedelic experience doesn't mean that's the way it actually is, right? If you're going through an experience and you felt you have perhaps fallen into a dark abyss and you've just been falling infinitely, that's not necessarily the truth, right? That's just how it feels in that moment. Your therapist could give you an alternative description there, right? What if instead of falling into an abyss, perhaps you are falling through a tunnel away from the abyss that you were previously in, right? There's different ways of looking at this stuff. It's just like dream interpretation. IRT is a great example here. Imagery rehearsal therapy. That is a good way to understand why a psychotherapist is important for psychedelic assisted psychotherapy. It's not the exact same thing, but it's a very similar underlying process, because what the psychotherapist is doing is they're helping the patient re-understand their dreams in this case. So oftentimes when I'm doing IRT, imagery rehearsal therapy, the patient is someone who perhaps has PTSD or some other specified trauma and stress related disorder, or something related to that front. And they're having these difficult and vivid nightmares. And they come to me and they tell me these nightmares are super negative or have this kind of impact on their life. And I want to take a step back, look at the experience itself, and go through it in intimate detail so that we can really understand what's going on, what led up to these experiences, and what we can integrate to help change this maladaptive way of looking at the dreams. It's very similar to psychedelic assisted psychotherapy. And in terms of my own experience here, especially with the psychology of awakening, it is also very similar, if not the same thing, with your own meditative practices. Now, in terms of the book that's coming out, The Psychology of Awakening, I promote primarily meditative practices. And there's a number of reasons for this. Again, I'm not trying to bash on psychedelic assisted psychotherapies, but there's just some inherent risks with the drugs. And you're basically going from 0 to 100, especially if you're using something like DMT. All of a sudden you're here, and then all of a sudden you're way up here, right? You're holding hands with God in a lot of reports from people, whereas before you were perhaps just down here eating McDonald's and a cheeseburger. Right? That's a bit of a jump within 5 to 10 minutes or however long it might be. Meditative practices are much more gradual in this sense. And this is great because what you find is that with meditative practices, oftentimes when people close their eyes, especially when they're starting out, they get really distracted and it's hard to make any progress. To make progress, you really have to put in the work and build a good sense of mastery. You don't really have to do that for psychedelics. You just have to take the drug. You just have to know how to breathe in a drug, more or less, or inject, or whatever it is you're doing. And that can be a problem because people may not be prepared in certain ways. Meditation is even a good precursor for taking psychedelics because we're looking at similar effects in terms of psychological mechanisms that are at play. But with meditation, we go gradually, right? You aren't really going to make progress until you build a sense of mastery. And that's what's really important here, because when you have that sense of mastery, you can keep revisiting and going back to stages. And dealing with altered states of consciousness, when you're in a meditative state, if you don't like the state you're in, you can just open your eyes, right? Put an end to it. That's great for people, especially those who are more susceptible to developing traumatic experiences. It also helps with gradually exposing and building up to the experience at hand. So that's a really good inclusion for meditative practices as well. Again, I don't do psychedelic assisted psychotherapy. Really, not many people do, but if I was going to, I would recommend meditative practices beforehand. I would want to prepare somebody, especially people who haven't had experiences before. I would want to prepare them beforehand with meditation, because the skills you develop, they translate very well. And we can see this as well with different types of psychotherapy models. My favorite, as listeners I'm sure will know, the psychological flexibility model. Lots of literature out there to support psychological flexibility model can mediate, in other words, explain the relationship between psychological outcome and psychedelic assisted psychotherapy, or just taking psychedelics, right? The psychological flexibility model, it outlines pretty well how you understand the relationship between what's going on for the psychedelic experience and what your outcome is going to be. Those similar mechanisms are at play. And again, we can really tie this down to neurobiology. Again, I've talked about default mode network, salience network, central executive network, psychological flexibility. We have different ways of looking at left and right hemispheric functions. We can really go down the deep end on this, and I'll just defer to my book for those things. But takeaway here is that there is a pretty good understanding, and I think this is just going to increase over time, that it is the psychological variables that matter the most with the psychedelic experience, right? It's not just blasting off, taking a drug, having some cool experiences, and then returning. If you really want to get a meaningful change out of it, it comes down to the psychotherapeutic and psychological process. Psychedelics, yes, they are a drug, but their mechanism of action is psychological. And I think that is the coolest part, so to speak, about these psychedelics, right? When we're looking at other drugs like Prozac, for example, you take your Prozac and then your symptoms kind of change. Typically, patients tell me they feel numb. If we get a good outcome, they feel like the adverse emotions have turned off, but maybe they can still experience some strong emotions. It's kind of like a neutering of certain emotional experiences in that case. And it's very different with psychedelics because, again, when you return back to your day-to-day functioning, you're back. But those insights, the things that really matter, those are what remain from the experience. That is a psychological mechanism, right? Attacking certain neurotransmitter systems and then removing or changing one's capacity to experience emotion, that is more of a physiological basis. So I think the psychedelic piece there is much more useful, because when you give medications like the Prozac, and again, I'm not attacking psychiatric medications in their entirety, but I am attacking the dependence on these psychiatric medications over building appropriate and useful psychological functions to deal with hardships in life, especially because these medications can cause problems over time and they don't teach very useful coping mechanisms beyond just taking more medication. So the main piece there is that if the psychedelic experience is based primarily in psychological mechanisms of action, why would you not need a psychotherapist, right? Why would you not at least need a good understanding of psychological functions to navigate this type of experience? Again, it's the exact same thing with all your altered states of consciousness, right? Psychedelics, sleep states, meditative states. There's even things like holotropic breathing practices. I think that's from Stanislav Grove. All of these different things, and there's many other forms of altered states of consciousness, by the way. Basically anything that impacts your neuropsychopharmacological functioning to a good extent, those can impact ASCs. Starving yourself, that's another example, right? And I'm not encouraging that, don't do that, but that is something that can also lead to altered states of consciousness. So again, if everything is more or less psychologically mediated, why would we not need a psychotherapist? This is the main takeaway here. If it was just about blasting off and seeing cool fractals or experiences or a connection to higher beings or whatever it is, dissolving the ego, if it was that simple, then people would just take these drugs and be good. But we know very well from literature and from accounts from people that it is the insight and understanding from the experience that matters most. Psychologists, mental health therapists, whoever it is that's trained, these are your specialists for dealing with those kinds of issues. So it certainly is the case that we need psychotherapy and psychotherapists to help navigate these experiences, especially for those who are not psychologically inclined or who are very unfamiliar with these things. All right, what else is there to say on that? So with the psychological flexibility model, I think I've done enough videos on that. I'm not going to go into it here, but maybe I'll touch on it later if there's some demand for it. Again, it'll come down to what people want or do not want. In terms of the actual long-term outcome, I was looking at some studies. I was even looking at some accounts from people on YouTube and what they talked about. It really does seem that once you navigate, and again, I can relate this to the psychology of awakening pretty well. Once you navigate and get to some solid insights that don't really dissolve with time, and when you pressure test them, reality test them, try to invalidate them, you can't. That's a very stable and useful way to ensure long-term outcomes. It's the same idea with the psychology of awakening. Once you realize this nature of ultimate reality, and you see exactly what it is I'm talking about from your own basis and realization and insight, that type of insight never goes away. It has not for me. It's been years, and it has not ever gone away from me. If anything, it's something that now is kind of like the fundamental basis of everything that I perceive, understand, and experience, and then all other things arise from that. So that type of insight is very, very useful. And oftentimes you will see people talk about getting these types of insights. And if they don't have psychotherapists and they have a good outcome, they might have these insights, but they don't know how to put it into words. That too happens a lot when you get just the raw experience of what has happened. And again, this can come through meditation, psychedelics, any type of altered state of consciousness. That type of experience, getting it, but not being able to put it into words, that is very useful and it's very helpful. But when you are able to put these things into words, it's easier to communicate, not just with others, but also with yourself. When we're sitting in our own thoughts, we're communicating with ourselves verbally. So when you have that as well, it's very useful. I can't really see a case where psychedelics would just be used without psychological mechanisms or psychotherapists. Perhaps in the future, if there are very good protocols, but still at some point you would need some kind of check-in or some kind of regulation. So yeah, it's kind of hard to see that without, maybe things will change. We'll see what happens. But even for taking other types of psychiatric drugs, you want a therapist there, right? Adverse effects, side effects, unintended effects, even intended effects. You want a professional who can really help regulate and understand what it is that's going on. So hopefully that helps with understanding why it is that we need psychotherapists for using psychedelic medications and the actual fact that the drug is psychologically mediated. I think all of those help make it pretty clear why we need psychotherapists. So I don't see any questions. I don't see anyone else. I still have a few minutes, so I guess I'll just keep talking and then we'll see if anything comes up. I wanted to come back to the neuroplasticity portion for psychedelics because I think it's really important in the sense that when you are recalibrating how your brain is wired and how it functions, it has a very deep impact on the psychological mechanisms that you do or do not engage in. So let's take an example that's not psychedelic. Okay, we probably said psychedelic too many times during this video. Let's turn to something else. Let's say we have an, yeah, I could pull this from personal experience seeing a certain patient, which I'm obviously not going to name here. She was an officer in the military and she was having a great career. She was doing super well. And then at one point, she was sexually assaulted. And it was a pretty bad sexual assault, pretty severe one. And that one experience, right? Going from a prominent officer being pretty well known, well respected, and then having this experience, just that one experience, it completely changed her worldview, her understanding of things. In a similar way, that type of life experience is kind of like a psychedelic experience in the sense that it is taking a lot of what you understand and believe about the world. It's basically blowing it out of the water, and then it just is left to resettle on its own. As you can imagine, with that type of experience, if you don't have a way to work through it, a sexual assault, especially a severe one like that, it's going to settle in a negative kind of way, right? Why did this happen to me? Why did I deserve this? I guess I did. I guess I do deserve it because it happened to me. I guess I'm a terrible person. Bad things bad happen to bad people, so I must be a bad person. All these different kinds of beliefs, right? They'll start to become the sediment, right? The sand starts to turn into stone, so to speak, and those kinds of things becomes more and more difficult to navigate around them. So a difficult life experience happens, and then a person doesn't really know how to navigate or deal with that type of experience. It's just way too severe and too difficult. So what do? They dwell in these negative experiences. It becomes too distressful. And then they turn to avoidance strategies because that's the only way they know how to deal with it, right? When you get to the point of avoidance strategies, you're basically just living a life that is surrounded by PTSD. Your whole life is about avoiding PTSD as opposed to actually doing what it is you want to do in life. That is precisely why we need psychotherapists and psychotherapy with things that can have that much of an impact on one's life, especially psychedelics. I just gave an example of sexual abuse, but really any type of event that causes that significant of a disruption in one's psychological functioning and understanding of things, that is very, very important to regulate in a positive manner and a useful manner for the patient. So I'll go ahead and leave things there. I don't see any questions. I don't see anyone. And I've gotten through everything I need to. So we'll leave it at that.